Hello, everyone. I'm Dr. Shih Huang from Taiwan. You can call me Benny. Sawadee krap. 禅特 Benny krap. It's my honor to attend this symposium. My topic is implementation of large-scale HIV self-testing in the Asia-Pacific region in adolescents and young adults. In the next few minutes, I will share the experience of self-testing in Taiwan. Let me clarify my biography. I am a doctor in a branch of Taipei City Hospital since 2012. Taipei City Hospital is the biggest HIV care facilities in Taiwan. More than 4,000 patients receive antiretroviral therapy in this hospital. I was a medical officer in HIV Prevention Division of Taiwan CDC since 2014. I assisted in developing national HIV prevention strategies, such as PrEP programs and self-testing program. The most important, I am living in LGBT community for decades. So I have three views: from public health sector of government, and from healthcare providers in the front line, and from the key populations, which were most affected by HIV epidemic in Taiwan. This slide showed HIV cases in Taiwan. The first case was in 1984. We can see after 2009, the annual new HIV cases increased continuously. In 2017, the highest number of new HIV cases in recent years. At the end of 2017, the cumulative HIV cases reached 36,000. What can we do? Compared with new HIV cases in 2009, the new annual HIV cases increased 53%. However, after 2017, the annual new HIV cases declined. In 2018, the HIV new cases decreased 21% compared with previous year. And in 2019, the new HIV cases lowered 18%. This year is 2020. The declining trend still exists in this year. So what happened? Is the treatment or policy since 2016? Or the PrEP program since 2017? Or the self-testing program since 2016? In Taiwan, younger populations are most affected by HIV. You can see the blue line is 25 years old to 34 years old, and the green line is 15 years old to 24 years old. The two groups accounted for the majority of new HIV cases for many years. However, the declining trend was more prominent in these two groups. And most of the younger populations are men who have sex with men. In 2011, NEJM published a result of a clinical trial. The risk of linked HIV transmission reduced around 96% among early treatment group compared with delayed treatment group. There were 3 large studies also showed the risk of HIV-linked transmission was 0 among serodiscordant couple if HIV-positive people are virally suppressed. This is called U equals U. Is the new concept of HIV prevention. Undetectable equals untransmittable. So WHO launched a new policy called 1990. If more HIV people are on treatment, lower the new cases. This is the situation in Taiwan. We estimated around 44,000 people living with HIV in Taiwan, and 88% of them know their status, and 90% of people living with HIV who know their status are on treatment. And people who are on treatment are very suppressed, around 95%. So totally speaking, around 75% of people living with HIV are very suppressed in Taiwan. So we compared the situation in 2016. The first 90 was 79, and the second was 84, and third was 88. So we can see the biggest gap in 1990 is first 90. So how can we do to reduce these gaps? Comprehensive HIV prevention bundles should include 2 sides. For HIV positive people, linkage to care, keep out, sustain viral suppression is very important. For HIV-negative people, provide prevention methods such as PrEP or condoms, continuous safer sex education, support regular tests to keep them stay inactive. For both sides, HIV testing is the key step. However, there are some barriers for target populations to take HIV test. So WHO recommended self-testing should be offered as an additional approach to HIV testing services in 2016. What are the advantages of self-testing? Self-testing is highly acceptable among various groups of users and in different settings. Self-testing doubles the uptake of HIV testing among MSM with men compared to facility-based testing. Self-testing nearly doubles frequency of HIV testing among MSN compared to facility-based testing. Self-testing is safe and does not increase social harm or adverse event compared to standard testing. Self-testing can be cost-effective and has potential to increase efficiency of HIV testing. To implement a new policy, we should know more about our target populations. What are the concerns and fears of them? This is a survey in 2017. The reasons of taking HIV testing among MSN: worry of getting HIV and habit of regular testing are the two main reasons for MSN to take HIV testing. What about unwillingness of taking HIV testing? For MSN, in the same survey, status known by others, inconvenient procedures, fear of HIV positive result, and witnessing need to test HIV are the four main factors among MSN. So, HIV self-testing is confidential to the users. And self-testing is easy to operate. Self-testing also can keep privacy. This is the self-testing kit we use in Taiwan. It's called Oral Quick Self-Testing Kit. The test is used oral fluid. So the outer package can keep confidentiality. And we also put a brochure inside, testing information, operating introduction, or others counseling material were all in this brochure. Initially in 2016, there were 81 sites and 23 vending machines. Users can get the kit from this site and these vending machines. So the picture is the vending machine we set up. Then in 2017, we extended this program. We enrolled more sites and we set up more vending machines. The most important is we start online ordering system. So the users can order the kit online and pick up the kit in 5,000 convenience stores. So you can pick up the kit. You can pick up the kit in the convenience stores nearby your home. So it's very convenient for the users to get the kit. Since 2018, we added fingerprint test for another kit. We also enrolled more sites and set up more vending machines, and we keep online order. So the picture, the right side is the oral fluid testing kit, and the left side is a fingerprint test kit. More and more kits were delivered from 5,000 to 55,000 kids. And the passing rate was around 1%. So how do users get the kits and redeem the money? People have to pay about 20 baht per kit. Then they perform testing at their home, assisted by video demo on our website or by hotline consultation, or by the instructions in the brochure or at our website. After the result, they can report the result in our website voluntarily, then redeem the money, the 20 baht. If the test results were positive, we have a referral system to refer the user to healthcare facilities. So we keep the connection. This is the web page we set up for ordering and reporting. So there are several information inside. The instruction of how to operate the kit and how to interpret the result, and safer sex education, and where to get the kit, and online ordering system, and transfer information, and login reporting systems. Also, a demo video on this website. In the real world, what's the utility of self-testing among MSN? Around 85% of participants in this survey test before, and about 20% of them use oral fluid testing kit. Around 25% of participants used self-testing kit. And the majority of them use oral fluid test, and others use finger prick test. How to implement this program? I think the promotion is very important. You can promote your policy or program by posters. So there are some informations on the posters, the QR code, the website information, and where can they get the kit. And this is me. Another important channel is mobile phone, the apps. In Taiwan, more than 19% of MSN use social media apps. So this is an advertising banner on apps. This is our advertising. So these advertising banners can reach our target populations. Most of them are younger population. Before this program initiation, we faced some obstacles. The first, the indication of self-testing using the kits was not approved by FDA because the kit can use only by professional healthcare providers. However, we issued this project for the purpose of public health, so the project was not restricted by the regulations of Taiwan FDA. Second, we thought cost may be the burden for younger populations because the original price for this testing kit may be 1,000 baht. However, we provide it in 20% of the original price. Third, disconnection between users who tested positive and healthcare systems was our concern. So redeem the money is an incentive to receiving referral message. If we log in the web pages and they key the result, if the result is positive, there are some message will show up to the users. They can also fill up their contact information if they want our staff to reach them. So we want to reduce the disconnecting rate. After this program implementation, what do we want to make program better? We enroll more community stores in this program, nearly double the numbers, from 5,000 community stores to 100,000. From 5,000 to 10,000 community stores, nearly double the numbers. And vending machines were easily stuck by coins. So we developed electro vending machine instead of mechanical version. And higher rate of invalid results when using fingerprint kits. So we increased the amount of oral fluid kits, and we sought other self-testing kits with good performance. This is the electronic vending machine version. One other consideration of choosing testing methods among MSM. The common considerations of choosing testing methods: accuracy, 78% of them; privacy, easy operating, time to results, and cost. For self-testing kit, the accuracy, the privacy, easy operating, time to result, is the advantage. For cost, I just mentioned before, we reduce the cost. What's the preference of self-testing kits? Because we have two different self-testing kits, oral fluid and fingerprint blood. Nearly 65 MSM prefer oral fluid testing, and others favor fingerprint blood testing kit. We found younger MSM were more willing to use oral fluid testing than fingerprint blood testing. However, MSM with HIV testing experience, having visited MSM community centers and having more sexual partners, favor fingerprint method. What we learned: people who did not receive traditional HIV prevention services may be reached by promoting oral fluid self-testing program. So we can reduce the gaps in first 90. Traditional HIV prevention services is okay. However, for others who did not attend or enroll by these traditional HIV preventive services can be reached by new policies such as self-testing. And we could provide tailored health educations to target populations with diverse preference and dispatch different self-testing kits precisely to them. Because the preference between different groups are different. And more never testers could be reached by self-testing, and the uptake of HIV testing among key population would be increased. So this is the value we implement self-testing. How to make an effective program more effective? They are A, B, C, D. A, awareness and acceptance. We have to make more people or more key populations aware of these new methods of HIV testing and prevention. And they have to accept this kit and understand the kit is good for HIV prevention. Be patient and be confident. This is for our public health sectors or healthcare providers, because a new policy, new things, people takes time to understand or accept the new things. So be patient and be confident. From our experience, the self-testing indeed increase the testing coverage and attract never testers into our prevention services. So we have to be confident. Contact and connect. We have contact the right persons, the leaders in the community, the KOL, key opinion leader, and we can connect the community, connect public health to LGBT community or other key communities. Deliver and disseminate it. For self-testing, we have to deliver more kits to key populations. And we have to disseminate this new concept of HIV prevention services to more people, to more key populations. Is very important. So I think not only for self-testing, but also for PrEP or others new HIV prevention concepts, ABCD is very important. Finally, we could end the epidemic. So A, B, C, D, E. E, end the epidemic is our final goal. Thank you for your attention. I'm glad here to share the experience of Taiwan. Hope in the future I can share more information to you. Goodbye.